ventilator is a machine that provides mechanical ventilation by moving breathable air into and out of the lungs, to deliver breaths to a patient who is physically unable to breathe or breathing insufficiently. Terms in mechanical ventilation. Volume control ensure patient received set volume of air each minute. Tidal volume, VT, volume of air set to be delivered with each breath. Frequency respiratory rate, F, number of breaths per minute. Oxygen concentration, FiO2, percentage of oxygen in the air mixture that is delivered to the patient. Positive end expiratory pressure, PEEP, constant pressure applied throughout expiratory. Pressure support, PS, push of air to help patient with spontaneous breath. NIF negative inspiratory force. It is a measurement or respiratory muscle strength and ventilator reserve. PaO2 partial pressure of oxygen. It is a measurement of oxygen pressure in arterial blood. It reflects how well oxygen is able to move from the lungs to the blood. PCO2 partial pressure of carbon dioxide. It often serves as a marker of sufficient alveolar ventilation within the lungs. Minute ventilation, VE, amount of air delivered per minute. VE equals VT times F. CO2 clearance. Peak inspiratory pressure, PIP, maximum pressure during inspiration. Plateau pressure, P-plat, lung compliance. It is measured during an inspiratory pause. Increased P-plat could mean problem with patient's lung compliance. Modes of mechanical ventilation. AC or continuous mandatory ventilation. Mechanical ventilator delivers a preset VT and F. Ventilator is sensitive to patient's inspiratory effort and delivers the preset VT for patient-initiated breaths. Respiratory therapist will set the VT, F, FiO2, and PEEP. When the patient takes spontaneous breath, the machine delivers full tidal volume. There is no pressure support on this mode. This can lead to excessive ventilation if tachypnic for non-respiratory reasons. Synchronized intermittent mandatory ventilation, SIMV. Mechanical ventilator delivers a preset VT and F. Patient is able to breathe spontaneously between ventilator-delivered breaths at his own VT and F. SIMV is synchronized with patient's spontaneous breathing, reducing competition between machine and spontaneous breathing patterns. Respiratory therapist will set the VT, F, FiO2, PEEP, and PS. When the patient takes spontaneous breath, the patient determines volume. This allows patient to take over work of breathing. Pressure support ventilation, PSV. Mechanical ventilator augments inspiratory effort with a preset amount of inspiratory pressure support. Pressure support is sustained through the entire inspiratory cycle as the patient sets VT, F and timing. An SIMV backup rate may be added for additional ventilatory support. Respiratory therapist will set the FiO2, PEEP, and PS. There is no VT or F on this mode. V with work of breathing equals patient effort. This is trial, before extubation. Example, 10/5, 10 is the pressure support, and 5 is a PEEP. Continuous positive airway pressure, CPAP. Positive airway above ambient pressure, applied to airway during spontaneous inspiratory and expiratory effort. Weaning a patient from a ventilator. Make sure your patient is ready for weaning trial. You and the respiratory therapist can make sure your ventilator patient is ready for weaning trial by assessing and intervening the following areas. Respiratory effectiveness. The patient has to be able to ventilate his lungs and maintain a patent airway. Check the strength of his respiratory muscles by making sure he can cough effectively and clear his airway of secretions. Get measurements of his vital capacity, the volume of air he can expire after maximal inspiration. A range of 10 to 15 cc per kilograms is adequate. Also, get a reading on his negative inspiratory force, which the respiratory therapist measures by applying a manometer to the end of his airway. A measurement of 20 to 30 centimeters of water is necessary for effective weaning. Another factor to consider is his minute ventilation, tidal volume multiplied by respiratory rate, which should be 5 to 10 liters per minute. The patient's tidal volume should be 3 to 5 cc per kilograms. You'd also look at respiratory rate, which should be 10 to 20 breaths per minute. Oxygenation, he needs a minimum PO2 level of 65 millimeters of mercury and a maximum FiO2 setting of 0.5. And gas exchange, considered adequate with a pH of 7.35 to 7.45, and PaCO2 of 35 to 45 millimeters of mercury. Also check his most recent chest X-ray result for any signs of pneumonia, which would rule out a weaning trial. Cardiovascular status. You need to know whether the patient's cardiovascular system can tolerate the work of weaning trials and the development of respiratory endurance. He shouldn't require aggressive interventions to maintain adequate baseline blood pressure. If he has hypertension, it needs to be brought under control. His baseline heart rate should be below 100. And his cardiac rhythm should be regular, with no malignant arrhythmias. Make sure his mucous membranes and nail beds are pink, with rapid capillary refill and no sign of cyanosis. Also, assess the pulse volume in his extremities. Understanding the different types of weaning modes. Weaning trial can be done in 4 different modes. Each patient is unique, so there are no guidelines on which mode to try first. Here's a brief explanation of each. Intermittent mandatory ventilation, IMV. This mode delivers a preset number of breaths per minute from the ventilator. Between ventilator breaths, the patient breathes spontaneously, with no ventilatory assistance. The number of preset breaths is decreased as much as the patient can tolerate, typically in increments of 1 to 2 breaths per minute. Continuous positive airway pressure, CPAP. This mode lets the patient breathe spontaneously without ventilatory assistance by applying constant positive, distending pressure to the airway throughout the respiratory cycle. The pressure keeps the smaller airways open, the alveoli inflated, and the patient's level of oxygenation adequate. The patient doesn't have to be disconnected from the ventilator and connected in additional equipment if the ventilator is designed to provide CPAP. This is an advantage, because alarm systems remain intact, and the patient usually doesn't feel as anxious as he would if he were disconnected from the ventilator. However, One possible disadvantage of staying on the ventilator is the resistance he may feel as he breathes through the ventilator tubing and his narrowed, artificial airway. Even off the ventilator, the patient may still feel some resistance from his narrowed airway. Make sure he's receiving adequate fluids to optimize his circulating volume and maintain liquefied secretions. Neurologic status. Check the patient's level of consciousness, orientation, and muscle strength. Make sure he's cooperative and alert. Find out, for example, if he's under the influence of central nervous system depressants, which can make him drowsy and compromise a weaning trial. Nutritional status. Look for signs of nutritional deficit, including low levels of serum albumin, normalis 3.3 to 4.5 grams per deciliter, and total protein, normalis 6.6 to 7.9 grams per deciliter. Remember that weaning consumes a lot of calories. Consult with the hospital nutritionist, mindful that your patient must have a positive nitrogen balance. He may require more than 2,000 calories a day so he doesn't start burning protein stored in muscle tissue. Check for significant weight loss, which indicates prolonged catabolic wasting of muscle mass, including vital respiratory muscle mass. The patient's diet should also be kept low in carbohydrates to minimize production of carbon dioxide. Also check how well he's tolerating his feedings. Acid-base balance. Metabolic alkalosis will need to be corrected because it impairs tissue oxygenation. Electrolyte levels. Closely monitor electrolytes, which play an important role in neuromuscular function, including respiratory muscle strength. The patient's serum levels should fall within normal ranges for potassium, 3.8 to 5.5 milliequivalent per liter, phosphate, 2.5 to 4.5 milligrams per deciliter, calcium, 8.9 to 10.1 milligrams per deciliter, and magnesium, 1.7 to 2.1 milligrams per deciliter. Hemoglobin count. Any hemoglobin-depleting condition such as anemia or gastrointestinal bleeding will need to be resolved. Make sure the patient has a stable hemoglobin level of 14 to 18 grams per deciliter so his tissue can be sufficiently oxygenated. Lingering signs of precipitating illness. Make sure the patient is fully recovered from the condition that put him on the ventilator. For example, pneumonia would need to be resolved to optimize gas exchange, eliminate fever, and decrease metabolic demand. Pressure support ventilation, PSV. This mode applies a specific amount of airway pressure through the ventilator to help the patient overcome the resistance he feels while breathing spontaneously through a ventilatory circuit. After the preset respiratory pressure has been reached, the pressure stops. The PSV mode can provide enough pressure to maintain a specific tidal volume. The pressure can then be decreased gradually, based on the patient's responses. The PSV mode is used to supplement IMV weaning and T-piece weaning by ventilator. T-piece. This mode calls for periodically discontinuing ventilator support and providing humidified oxygen to the airway. The intervals of spontaneous breathing are gradually lengthened as much as the patient can tolerate, helping develop his respiratory muscles' strength and endurance. The humidified oxygen is always set 10% above the previous FiO2 setting on the ventilator to compensate for breathing pattern changes that could lead to hypoxemia. Not all ventilators are designed to provide T-piece weaning. For some models, the ventilator tubing may need to be removed and replaced with a T-piece weaning. For some models, the ventilator tubing may need to be removed and replaced with a T-piece attachment. An extension tube is then added to the T-piece to avoid mixing the humidified oxygen with room air during inspiration. The T-piece mode can increase your patient's anxiety because it means he'll receive no ventilatory assistance. But it can also lead to a more comfortable situation for a patient with a tracheostomy tube. After he's had consistently successful weaning trials, the tracheostomy tube can be replaced with off-fenestrated tracheostomy tube. Factors to correct before weaning begins: acid-base balance, altered state of consciousness, anemia, arrhythmias, decreased cardiac output, electrolyte abnormalities, fever, fluid imbalance, hyperglycemia, infection, pain, protein loss, renal failure, shock, sleep deprivation. Weaning parameters: awake and alert, PEEP less than 5 cm of water, PaO2 greater than 60 mm of mercury on FiO2 less than 0.50, PaCO2 acceptable with pH of 7.35 to 7.45, F less than 25 per minute, VT 4 to 5 milliliters per kilograms, VC greater than 10 to 15 milliliters per kilograms, VE 5 to 10 liters per minute, MVV 10 to 20 liters per minute, NIF greater than or equal to 20 centimeter of water. Weaning techniques. Modes used to wean a patient from mechanical ventilation include alternating assist control (AC) or continuous mandatory ventilation (CMV) with periods of T-piece trials with or without CPAP. Gradual reduction of the SIMV rate. Pressure support ventilation care and attention to details during the weaning attempt are often more critical than the methodology used. Assessment criteria for termination of weaning: decrease in level of consciousness, diastolic blood pressure greater than 100 mm of mercury, fall in systolic blood pressure, heart rate greater than 110 beats per minute or greater than 20 beats per minute, increase over baseline F greater than 30 per minute or greater than 10 per minute, increase over baseline VT less than 250 to 300 milliliters, pH less than 7.35, PaCO2 increased by 8 mm of mercury, premature ventricular contractions greater than 6 per minute or salvos, changes in ST segment, usually elevation, ventricular conduction changes. I hope you learned from my video. Press subscribe and share to support my channel. Press the bell button to be notified with my upcoming videos. Thank you.